Jane here again for our weekly Facebook live program. I have don't tell my other guests, but I have my all-time favorite guest here, Dr. Charlie Lockwood. We will get back to him in just a minute, but I want to update on the virus. Unfortunately, after doing so well, we are starting to creep back up. And creep may be a relative term because it seems that the positivity rate is increasing a lot quicker than it was decreasing. So the case totals 48,869 total cases in Hillsborough County, and that includes 822 deaths. I believe the last Facebook Live there were 720 some, so that's quite an increase. In Florida, 816,700 total cases. And within our state, we have 17,099 deaths. 3,099 people have been tested in Hillsborough County yesterday. So the testing is increasing dramatically. And we are at a positivity rate now of 7.3. We were down positivity rate about 5.3, 5.2 as we were working down. And then, as I said, we've gradually come back up. And unfortunately, I think our discussion today isn't going to be a happy one as far as the positivity rate or the number of cases that we're going to see here in our area. So let me give a little bit of background on my favorite doctor. At USF, Dr. Lockwood leads the Morsani College of Medicine and the colleges of Nursing, Public Health, and Pharmacy, and the School of Physical Therapy and Rehabilitation Sciences. Dr. Lockwood is also a professor in the Medical School's Department of Obstetrics and Gynecology and holds a secondary appointment as a professor in the USF Health College of Public Health. He assumed all these leadership roles when he joined USF Health in May of 2014 and has also served as an executive vice president at Tampa General Hospital since 2015. Dr. Lockwood graduated magna cum laude from Brown University, received his medical degree from University of Pennsylvania, and a Master of Science degree in Healthcare Management from Harvard School of Public Health. So incredibly accomplished individual. And it always makes me feel so much smarter just to hang out with him. But we're going to get right to it here. And so in a nutshell, can you just bring us up to date on how we're doing and if our efforts at social distancing are helping?
Well, there's good news and bad news, and the good news, I guess, would be that this particular phase of our drama has been impacting younger folks, right? So the mean age, the median age of new cases is hovering right between 20 and 30. Whereas for hospitalizations, it's 70, getting older. And then for deaths, unfortunately, still with us, it's 80. So they're really different numbers. And what that tells you right off the bat is, if you're older, if you're particularly over 70 and you have all these multiple comorbidities, stay home, stay inside, continue to wear masks and when you go out and so forth. I think a lot of the spread that we're seeing in the younger age group is because schools are opening. And I literally get a call every day from some frantic mother. They're third grader, but they told her that she doesn't have to isolate, doesn't have to test. And the truth is the school's doing a great job. They've done a really, really good job with social distancing and face masks and with tracking. And they've done a really good job with figuring out who's at risk. So, if they tell you your child needs to be quarantined, and assume that child is going to be positive. So, but unfortunately, it is a little incubator for the virus, and so we're seeing all these younger folks getting infected. Now, the reason that's, I won't say good news, but it's not terrible news, is they're much less likely to get sick. And so while there has been some slight increase in the hospital census and admissions, particularly over the last 2 days, up to now, we've been relatively unscathed. So if you look at the Tampa Bay Times little grid that we see every morning, you'll see, cases are up and they're up to around the 253 a day, but hospitalizations have all been less than 10 for the most part. Occasionally they'll be higher than that. And so that's really different than it was in the peak of the summer, when we were seeing, 30 hospitalizations a day or more. So the hospitals are not being overwhelmed. They're not being particularly burdened. Tampa General is full just because we're full. We're not full of COVID patients. We don't have that many. We just have a lot of patients. So it's a little misleading when you look at the ICU occupancy. Most of those folks don't have COVID. Now, at Tampa General, they've opened the new infectious disease hospital, and that has decanted all the COVID cases. And most of those are in pretty good shape. Very few of them are intubated. So the patients we're seeing in the hospital seem less sick. And again, fits with the younger age group. So, I think that I'm disturbed by the increases in cases. I don't think that we're reaching the point where, we need to say, oh my God, we need a lockdown or anything like that, but we need to redouble our efforts. That we're in the fourth quarter of this pandemic. For the love of God, keep using your face mask, keep washing your hands, keep socially distancing. We're going to be through this. We will start vaccinating probably, my guess is in mid to late December. And then it'll really pick up in January and February. And hopefully by March or April, most folks will be vaccinated and they don't have to do any of the things I just said. So, we really are close to being done. I know people want to give up. They're really frustrated, but just don't, and just do the right thing. We're almost there. And this is no time to drop your guard down.
Yeah.
And, again, young people feel invulnerable and then they go home and they infect grandpa and then grandpa dies. And that's not good.
Now, I want to expand on that a little bit. So I always blame you for giving me just enough medical information to make me dangerous. But I was actually on a panel with some doctors from USF. And so there were questions about, why some people get COVID and they're asymptomatic and others get it who seem to be relatively healthy and die. And there were some theories of it could be related to your blood type, that may have an impact. Your immune system, the strength of your immune system may play a part in it as well. And then even the idea that, whatever dose of it, of the virus that you got, that you may not have, have received a full dose of it. So what are your thoughts on those three areas?
Well, the dose effect is definitely a real phenomenon. The lower the dose, the more likely to have less of a viral burden. Your immune system can contain it. You're going to get better. And how do you lower the dose? You wear a mask. You socially distance. So, getting a theme here.
Yeah, right.
So the blood type seems to matter a little bit. It's not as big a deal as we thought. Best to be O negative like me. Bad to be AB positive. But I mean, really minimal differences. Don't panic if you're not O negative. So the other factor that has been intriguing is what you mentioned, which is if you go to a nursing home and you look at outbreaks in nursing homes, 40% of those patients are completely asymptomatic. Now that is stunning, right? That makes no sense at all. The rate of asymptomatic infection in nursing homes is very similar to what it would be in 30-year-olds. So there's something else going on here that I suspect when we figure out, somebody's going to win a Nobel Prize. My suspicion is that these folks have partial immunity. They have partial immunity because they were exposed to common cold coronaviruses. So 25% of common colds are caused by coronaviruses. We call those endemic coronaviruses. They have a spike protein. They look a lot like the big RNA virus that SARS-CoV-2 is, and they share a lot of the immunological properties. So my suspicion is we're going to find that a lot of these folks have partial immunity, enough to be asymptomatic or minimally symptomatic. And that's why there's a big difference, because nothing else explains it. None of the factors you just described can fully account for it. But they are important. And again, you can mitigate the dose by masks and social distancing and hand hygiene. But I think that that's probably another factor. Now, the good news is it suggests that the vaccine is going to be wildly successful,
Okay.
because even if you don't have complete immunity, we call that sterilization immunity, where
Mhm.
it's like you have a sterile respiratory tract, you're not going to get any infections. Partial immunity is really good, and it can prevent some of these really severe cases.
Mhm.
So I'm really optimistic that the vaccines are going to work, and I'm very optimistic we're going to have them relatively soon. So
Good.
don't drop your guard. That's the
Good. Good.
theme of the
And
day.
then also, is there anything to the idea? And I don't even remember where I heard this. It was not on social media, but that individuals who had received a flu shot the previous year, that they were less inclined to get the virus.
Yeah, well, so some people think that the flu shot augments your immune response.
Okay.
And so I got my flu shot, and given my age, I got my pneumococcal vaccine as well. And that's important, A, because it may augment my general immunity and make it less likely to be sick with COVID. But two, the one thing you don't want to have, trust me, is the combination of influenza and COVID, or influenza and pneumococcal pneumonia, because that will kill you.
Yeah.
So getting your flu vaccine, critically important. If you're older, the quadrivalent vaccine is best. If you're over 65, make sure you get your pneumococcal vaccine as well. And then you're really, A, you may do better with COVID if you get COVID, but B, you're not going to have these comorbidities that could be really, really, really life-threatening.
Yeah, the group, speaking of the vaccine, the three doctors that I was on the panel with, they were talking about, okay, now you have a vaccine, who gets the vaccine? And two of the doctors said, well, that probably is going to be a political decision that it weighs in. And the one doctor said, well, clearly it needs to be given to the super spreaders. And so I said, well, how do you know who the super spreader is? And he said, I don't know. So, do you have any thoughts on that too, where you read these stories of individuals that go into they have 50, 60 cases traced back to them.
Yeah.
And then I know someone, a relative of mine, that was with a group of 10 individuals over a weekend, not knowing that he had it. And the only person out of all 10, there was one person that got it, and he was in very close proximity to
Yeah.
them. So,
So, the most common setting is like a church choir, or you're at you have a party, you're watching the Gators beat up on somebody, and you're screaming, and you've been infected, and you're 1 day away from having symptoms. That's when you have the highest viral load, and you are just spreading that virus everywhere. And no one's wearing masks, and they maybe drank some alcohol, so that damages their immune response. They're particularly vulnerable, and that's a recipe for a super spreader event. So you can't pick super spreaders other than to test their IQ and maybe give the lower IQ folks the vaccine. I don't mean to be fresh, but I think the strategy is going to be obviously healthcare providers, because we need us so we can take care of you in the ICU. Number two, it would be the vulnerable populations, nursing home folks, people over 65, people with comorbidities, particularly kids with congenital heart disease and cystic fibrosis and so forth. And then you kind of layer it down to the healthier and healthier group, the people in their 40s and their 30s, their 20s, 10s, and so forth. And so we'll have a strategy for triaging it. Now, the more vaccine we have available, then at some point we're going to say, hey, we got plenty of vaccine, just come in and get your shot. But we need 70% of the folks to be either completely immune or partially immune to get herd immunity, and then we'll be done.
all right. Well, let's talk just a little bit more on, you talked earlier about fewer patients having to be intubated. And I know for sure, and I assume the other hospitals have it as well, is that there's a very robust triaging system when individuals present themselves to the emergency room, and quite often individuals are sent home to be monitored, and then if they deteriorate, they come back. So talk a little bit about the advances in the treatment that have allowed the medical professionals to not have to intubate and not have to put people on ventilators.
Yeah. So the two most important are dexamethasone, which is an anti-inflammatory, it's a steroid. It's an anti-inflammatory agent. You might hear that somebody got injected in their back for back pain. That's the medication. Just a little variation on that one, and that has been shown to reduce death. So that's good studies, randomized clinical trials. It works. The second are monoclonal antibodies. The product that President Trump received from Regeneron is very effective, particularly when used in early stages, because it prevents the spread of the virus. The antibody binds to the virus and prevents it from going into cells. So that's a really effective drug. We think it's going to dramatically reduce deaths, and it's going to shorten the duration of the illness dramatically. I think you saw that with the president. The third drug is remdesivir. That has a little bit less efficacy. It lowers the length of stay, so it shortens the duration of the illness, but it doesn't have the powerful life-saving properties that dexamethasone and these monoclonal antibodies have. And people are still using convalescent plasma therapy. Works kind of like that Regeneron product. Now, there are a number of other clinical trials that we're looking at other agents that we'll see whether they're also beneficial. It might be a cocktail of 4 or 5 drugs we start to use. But just those 3 have made a huge difference, particularly when they're used early. Mm-hmm. And that, I think, is one of the reasons we're seeing this really improved survival in the hospital. So we're fairly optimistic about that. I think we're eager to get the vaccine, which is going to be the definitive way to stop this.
What are some of the long-term effects that you're seeing? I know that people, the respiratory system, and then sense of smell and taste. Some people have it. I have a friend who had it 130 some days ago and still hasn't gotten his sense of smell and taste back.
Yeah. So, I mean, the most severe, what we call sequelae, the consequences of the infection, are primarily lung disease and chronic lung disease. We actually have some patients now on transplant lists, lung transplant lists. That's how severe the fibrosis, the scar tissue in their lungs is. There seems to be at least some evidence of cardiomyopathy, heart failure, although they mostly get better, fortunately, on their own. Acute renal failure and needing to be on dialysis and occasionally be a transplant candidate there too is a rarer complication, but we've seen that. And there are receptors for the virus in the kidneys, so it does make some sense. So those are the big 3, I would say. Some of the other things that people talk about are COVID brain, where they're just not focusing like they thought they used to before they were infected. Whether they were or not is a different issue. And then people do say that their taste their tastes have dropped. And our noses have amazing neurons that are able to do our smelling, and so much of taste is related to that. But they're right there in the respiratory tract where the virus can easily infect and damage those neurons, and it takes sometimes months and months to recover.
Yeah, that's so frightening, and those effects, with the lungs and different organs, are those mostly in individuals that have some comorbidities, or have you been seeing that in very healthy people that
yeah, mostly folks that are older and have comorbidities, but there are examples of younger folks that have had really severe lung disease, and I haven't heard of any that have to be on transplant list, but
yeah, that's scary. Now, I know up north there's been some huge spikes in states where it's started to get cold and people are pushed inside. And I said, down here in Florida, we've just gotten to the point where we can actually be outside for more than 4 or 5 minutes. So, that's why I thought that we would sort of avoid this spike in the cases. But do you feel that we should be taking other steps in addition here in Florida to ensure that we don't see a larger spike?
Yeah. So, I think we're seeing some overlapping phenomena. Obviously, the initial pandemic hit the Northeast, and they were ill prepared for it. They didn't have PPE, they didn't have drugs, didn't know much about the virus. By the time it hit here, um, they primarily approached it by containment, by locking down everything, and that has left a vulnerable population of folks that weren't infected there. That if you think of a forest fire, that are the equivalent of dry kindling, but not much. I mean, a lot of people were infected. In some boroughs in New York City, 25% of folks were infected. So the vulnerable people probably were already infected. So I'm not surprised that New York's not seeing any big surge of folks in hospitals at this point. Then we got it in the summer when we were inside, because it's Florida summer, and now I think a lot of folks that were really vulnerable, would have really gotten sick, the dry kindling, have either gotten sick and are immune, or sadly may have died, or are really careful and continue to remain very careful. I was just with a 90-year-old, I had lunch with him, and really meticulous about doing all the right stuff. So they are still vulnerable, but there are people that are going to stay safe because they know what to do. But there's not a lot of dry kindling in the sense of people that are very vulnerable. There's a lot of wet kindling, 20-year-olds that aren't going to get really sick, and that's kind of our phenomena. But if you go up into the Dakotas and Nebraska and Wisconsin and Minnesota, those people really never had the infection in the first place. Very, very minimally involved, and now they have lots of dry kindling. They're indoors. They're back to New York City in March, and it's going to probably get worse there before it gets better. But ultimately, the same phenomenon will occur. A lot of the folks that are going to get infected. They're immune, and they begin to have drops in hospitalizations and so forth. So, I mean, we're seeing what is a normal pattern of a respiratory epidemic. This is not that unusual. What's unusual is that, ironically, because it's so lethal, we've suppressed the infection with lockdowns and with masks and all the other measures we've taken, and that means people aren't getting infected, so they're not immune. And so it's why this is so weird, is that we're seeing these three separate outbreaks, but it's not like they're equally severe, because there are a lot less folks that are likely to get really sick in the Northeast and the South compared to the Midwest and the kind of near far West.
Mm-hmm.
So I think we're seeing stuff that makes sense, honestly. It's not so surprising, the patterns that we're observing. But again, I mean, we're either through achieving, unfortunately, natural herd immunity or through the vaccine, we really are in the fourth quarter. I mean, we really can kind of wrap this up. And Tom Brady does not back off in the fourth quarter. He pours it on, right? He tosses those little slants to Gronkowski, and wonderful things happen. And that's how we have to be. We have to be little Tom Brady's that wear a mask, socially distance. We're almost, the clock's ticking down. I see, the Super Bowl right around the corner.
Yes.
So just don't give up yet.
So that's a great lead into the with the Super Bowl. So if we do see a spike, what are the modelers? What are they saying for us? And as you and I spoke before we came on live, was that there is the idea that we will see a spike November in about a week, that we should see a spike here. But as you indicated, the modelers are about as good as the political pollsters these days.
Correct. Exactly. Well, I think we are seeing a mini spike. I don't think this is anywhere near the magnitude of what we experienced in the peak in the summer. We had a day when we had 800 cases. So we're 230. I think we'll peak at about 300 and hopefully then start back down again.
Okay.
But we can speed the process up, make sure our businesses stay open, make sure the Super Bowl is played, and by wearing masks, social distancing,
Right.
and hygiene.
Yeah, nobody's ever heard that before.
Right.
We're still getting the pushback with the masks, but it really is just such a small minority. I was on a presentation from actually a political individual that provided political advice. It was U.S. Conference of Mayors, and he said that 90% of Democrats endorsed and wholeheartedly accepted the effectiveness of wearing a mask, and that over 60% of Republicans did. So it's a very small number. Unfortunately, it's a very loud group. So I know that what we were looking at doing was setting a positivity rate that, around 3-4%, something to that point that, by the time we got there, then we may not need them and people could still choose. I think people would still choose to wear them. I'm kind of getting used to the mask now. I'm not sure I'd know what to do without it. So talk to me about, well, that's good. That's a good reason for everybody to wear those masks. We all want to have a Super Bowl. We are going to have a Super Bowl, and it is going to put us on the world stage. But if we are doing the right thing and we have this virus under control, the more fans we will be able to safely put into the stadium. And so that's a huge economic driver for our community. So we all have to keep that in mind as well. So talk to us a little bit about your syndromic survey that USF, the College of Public Health, has put together, and what the results of that survey are actually going to be used for.
Well, I mean, we're kind of approaching this at many levels. At the university, we obviously are doing pool testing. So we're testing everybody and testing environmental services and testing batches of students. And we really are doing pretty well here in terms of the number of infections. It's relatively low compared to other schools like the University of Tampa and the University of Florida, Florida State. We're much lower. So, and that's a combination of very aggressive testing, contact tracing, and obviously we're well positioned with our College of Public Health to do that. But it's also great compliance by our students. They're doing a really good job of that. The medical students are kind of like the Army Rangers of students, and we pool test them on a weekly basis, and we've had no infections. So since July. So, you have really dedicated young future physicians. They're incredibly compliant. They do everything exactly the way they're supposed to do it. And we've had no infections. So it's kind of the proof that if you follow the rules, you will not get infected. And bear in mind, they're seeing patients. I mean, they're in harm's way, but they're very, very, very careful. And they're obviously careful when they're on their off hours as well. So, I think those things happen. From a syndromic surveillance perspective, the key elements are not the sophisticated modeling that Ed Michaels does and all that, which I can't even begin to contemplate, all the variables and regression formulas and so forth. It's really looking at influenza-like illnesses in emergency rooms, COVID-like illnesses in emergency rooms. And the good news there is we're not seeing huge spikes in Hillsborough County. We're seeing a little increase. It's not like that. It's like this. And so it's one of the reasons I won't say blasé, but my hair is not on fire. I don't have much hair left and I can't afford to have it on fire, but I'm reassured by that. And so if I see a pickup there, it would actually be reflected in the modeling because it looks at all these parameters. And then I think we need to be more concerned. But, we are predicting, the College of Public Health is predicting a spike in the next week or two. And we really do need to double down on our known ways of preventing the spread of the virus.
Which would be wear that mask, without a doubt. Well, that's wonderful. Tell us a little bit about the pilot programs that you had going on at TGH. I know at one point it was a good problem to have, but you didn't have enough patients with which to do your testing. Clearly, one of the initiatives that your group worked on, or the School of Engineering, were the swabs, when we ran out of the swabs, and you actually provided those worldwide. But did you learn anything else from any of the tests that you did?
Yeah, so we were part of the remdesivir trial, so that was useful, part of the Regeneron trial. So everything the president got, we tested, dexamethasone, and those studies are mostly completed. We've also looked at some other drugs that didn't work out so well, and they're obviously not going to be used frequently. I'd say the most exciting studies we have going on right now are a vaccine trial for kids, and then an adult vaccine trial. There are three flavors to the vaccine. There's the RNA vaccine, which injects RNA, gets taken up by cells, it makes a spike protein that causes an immune response. That seems to be safe and to confer at least partial immunity. Not a super immune response, but solid, and certainly one that would prevent you from getting ill. The adenovirus one, which uses an attenuated virus, a virus that doesn't make you real sick, that produces lots of the COVID proteins that you mount a big immune response to. Now that you probably have read about two of those trials, Johnson & Johnson and AstraZeneca, being suspended for side effects. You get more side effects with that, but you also get much better immunity. And so it's a little bit like a Goldilocks puzzle. The third flavor, and the one I think is going to be the most successful, is with protein, kind of more like the influenza vaccine. Doesn't have RNA, so it's not doesn't creep me out injecting nucleic acids into my blood. It's not a virus that I'm a little bit concerned about, but rather it's the protein that your immune system is going to recognize, make the antibodies to. And the beauty of that particular strategy is we can put that in our influenza vaccine every year and give a combination so that we make sure this never happens again. So all three vaccines look great. I'm not sure which one I honestly would take. Be happy to take any.
Take one of them. There you go.
You can be sure I will line up first to get my shot. But we're excited about this protein vaccine particularly. So we have 30 studies now that have been approved, and we're probably about halfway through most of them, and we're done with a few. So it's been a whirlwind of activity. Most of these studies have been approved within a couple of weeks. It used to take us like 6 months. Mm-hmm. And we got so efficient that John Corus and I decided, you know what, why don't we just combine our clinical trial office? We'll be much more efficient at it. And we've done that so that Rachel Karnofsky, who's our fantastic director of our clinical trial program here at USF, is running both services. And that's gotten a much more efficient operation, streamlined it, and I think it's one of the reasons we've been so agile in this epidemic.
Well, that's great. Now, a question: how effective is the convalescent plasma?
So it depends on when you get it. The earlier you get it, the more effective it is. It also depends a little bit on who you get it from. The sicker the person, the better the plasma. Okay. Men seem to produce a little more antibodies and they get sicker than women. Older folks make more than younger. So, if you're lucky enough to get the right really sick patient that recovered plasma and you use it really early, it's about as effective as the monoclonal antibody. If you get a less effective one and use it later, it's less effective.
Now, are they categorizing that plasma? I mean, would you know, like, would they say, okay, this particular plasma came from someone who was
No,
okay. So you
but
don't have, it's kind of
they
a,
do, right. They do measure neutralizing titers. So there's a way of
okay,
standardizing it. Yeah.
okay, that makes sense. That's interesting because we're working with a group to try to encourage individuals who have recovered from the virus to provide that plasma. So here's a question too, and this is something that I don't know. Well, clearly I don't know the answer to because I'm not a doctor, but it has an effect on a lot of people. So I just got a text yesterday about this. Um, Somebody tests positive. They're they go through it. They have mild symptoms. They stay quarantined for 10 days, but then they continue to test positive for
Yeah.
several weeks.
Yeah.
So, do they need to stay quarantined? And why are they testing positive when they've cleared?
No, and they probably shouldn't keep being tested. So if you quarantine for 14 days, that's great. If you quarantine for 10 days and you've had no fever for 3 days, you're good to go. But you obviously want to be 72 hours of no symptoms.
Okay.
That's really seems to be the best measure. The secret of this is you're most infectious before you're sick, the 24 hours before you're sick. Then you're really infectious for the next 3 days. By day 5, you become much less infectious, and after that, it just keeps dropping. I mean, some people can still be infectious up to a couple of weeks, but in general, it peaks right around the time you develop the symptoms. So the RNA test, the nasal, horrible uh, nasal test,
Scratch your brain
um,
test.
right, in your brain. That's an RNA test. And so that measures not only live virus, but dead virus and cells that are excreting the RNA from the virus that aren't in folks that aren't infected at all. And sometimes that can be for months, but it's
Hmm.
meaningless. It doesn't.
Okay.
So the antigen test that measures the viral protein that uses saliva is actually quite efficient. It's positive the day before. It's positive for about 3 days after, exactly when you're most infectious. And then it's less effective thereafter, but then you're much less infected too. So I'd like to see people using that test more often. It's gotten bad press because it doesn't have quite the accuracy of the RNA test, but it has many less false positives as well.
Huh.
And it's quite effective at the time you get infected, that you're most infectious, rather.
Okay. So how important is it for, because we saw a dramatic decrease in the number of people getting tested for COVID-19 and actually closed down testing sites out in different parts of the county. How important is it for people to be tested? Um,
Yeah, well, and I see the numbers are back up in the state. They're
yeah.
like at 100,000 again. It's really, really important because it's the only tool we have to identify, um, uh, to do contact tracing, to try to identify folks that are at risk and get them secured. And it also helps us measure disease activity. So those
Mhm.
are kind of the two big reasons to do it.
It was interesting. So again, another relative that worked for a government agency called in sick, and they said they had a rule that if you called in sick, you had to be tested for COVID. And she and her husband both were tested completely asymptomatic, and they both tested positive,
Yeah.
and would have had no idea that they had it. So, are we
Good.
seeing a lot more of that? And is that I know I asked you this before, and you said that the strength of the virus, although the virus had mutated several times, but the strength of the virus hadn't decreased. But we see so many people that are really asymptomatic or have very, very mild symptoms.
Well, across the whole population, 50% of infections are asymptomatic. 50%, one
Has that
in
always
two,
been the case?
pretty
Okay.
much since the beginning. 80% are mild. So, again, I think this is because we harbor some partial immunity in half the population, maybe even more than half the population in certain groups. So, So a lot of folks are going to be asymptomatic, and yet by doing that test, they will stay isolated and they won't affect other people. So it's very useful. It's another value of being tested. Um, just when I've been out in the testing centers torturing people, when I ask them, well, why are you here? Most of them tell me because of contacts. You know,
Okay.
their cousin, the next door neighbor plays with their kid, and we're happy to test everybody. And obviously about 6% are positive, so they can then be quarantined and hopefully help to we're not going to stop this infection, but at least slow it down.
Yeah, we didn't see, how I felt about opening the bars in July, and we saw that huge spike, and then we recently opened bars again, and I see everybody for some reason feels a need to send me all of these videos of young people waiting in line in bars or inside bars, crowded, no masks. And I anticipated a spike, and when it didn't come, I thought, well, they probably all already had it, and so they're all
You
fine.
you are probably correct.
Yeah, that's incredible. Now, do we have any better idea on the length of immunity to it? I know there was somewhere in the ballpark they were saying about 2 months that individuals wouldn't be able to be reinfected.
It's probably going to be more like 6 to 9 months.
Oh, good.
There have been some cases of bona fide reinfections with slightly different strains of the virus. So it requires two things. It requires time and a new virus, a virus that's just different enough to evade your immune system. But the people that have been reinfected have been very mildly infected.
Hmm.
So they do have partial immunity.
Okay.
So I think we can have yearly vaccines that should keep this down to a dull.
Yeah, excellent. But then don't you think that was another thing on the panel? They were talking about the origin of this particular virus, and the response was that the medical field feels pretty confident that it came from some species of bat, but there's so many bats that, and so the question was, can we prevent these types of things in the future? But the response was, as we continue to populate the earth and move into areas where human beings have never been, you're going to discover different species of animals and find these diseases that may have been confined to those particular locations. So it was actually a pretty depressing answer.
Yeah, I know. We need to, number one, make sure that we have a sustainable population and not go crazy. Number two, we need more Teddy Roosevelts. We need to do more to conserve our land and prevent
Yes.
urban sprawl and encroachment on these natural habitats,
Hmm.
particularly in the case in China of these bats, because there
Yeah.
are a lot of bats in Southeast Asia and China. And the bat is this weird species that has this kind of symbiotic relationship with viruses. The virus infects them. They don't seem to get sick, but then they harbor the virus. The virus
Hmm.
can mutate, and
Yeah.
when you encroach on their habitat, they will. That's it's their secret weapon, and
Yeah.
they will get you back.
Yeah. Yeah, so is there anything that we could do? I mean, how could we have possibly planned for anything like this
Yeah,
pandemic?
I'm not one to attack politicians ever because I'm in a public medical school. But I honestly don't think that I think we did the best we could under the circumstances. Sure, we might have been able to do something a week earlier, but unless you were willing to lock down the United States, close our borders, there was no way this wasn't going to happen. And I think that the governors of the states that have been most effective have all done slightly different jobs, and will study what they did for many years and make assessments. You could say, well, Governor Cuomo did an amazing job. Well, yeah, but his case fatality rates, three times what Florida's was. So, and the economic impact on New York was much greater than it was on Florida. So you're balancing so many different objectives, economic objectives,
Mhm.
maintaining some social cohesion, schools and so forth. I'm just glad I was not governor or mayor during this crisis, because you had to make really tough decisions. Um, and no matter what you decide, somebody was going to tell you you were wrong. I know this is
No doubt.
familiar territory
Yeah.
for you as the mayor, but if we were just to listen to the doctors, hey, we would put everybody, in their rooms for 2 weeks and not let them out. Well,
Yeah.
you can't do that.
Right.
So, I think for the most part, under the circumstances, with the lack of knowledge about this virus that we had, folks did a pretty good job.
Hmm.
I think we're going to never do this again. We're going to have plenty of PPE. We're going to have uh, vast reserves of basic drugs like um, antivirals and dexamethasone. I think that we will spend a lot more money on our pandemic surveillance teams, both in the United States and around the world, to better identify this and start to develop vaccines before there's a pandemic, so that the minute it shows up, we can scale it up and vaccinate folks. I think we have learned our lesson from this horrible pandemic. We could have listened to people like Bill Gates 10 years ago, and
Yeah.
we would have been all set. But
Right.
we're Americans, and as Winston Churchill said, we always do the right thing after we've tried everything else.
There you go. There you go. Perfect. And you know why Governor Cuomo was so successful? Because he had his mom on his show. So that right there does it. All right. We have some questions from the media from my good friend Melanie Shoebrooks. Um, well, Melanie Michael, her TV name, from WFLA News Channel 8. Let's see. Is Florida considered a red zone right now?
No.
Hot zones.
So we're I think pink. Maybe I forgot the color scheme that they use. We're not green,
Right.
which would be declining. But the number of cases per 100,000 are nowhere near where they were in the summer. They're enough to increase mask wearing, social distancing, hand hygiene, no gatherings of more than 10. But they're not enough to even, I think, remotely think about a lockdown.
Okay. And then should families rethink their Thanksgiving plans?
That I get asked 100 times a day, I think, including my own family. And it is my favorite holiday, and I do love turkey, and it's a gluttony that I can get away with. And the answer is that if you have older parents, grandparents, and so forth, probably not a great idea to have them join, a big family gathering. And if you are going to do it, make sure that folks wear masks. They try to social distance as best they can. Obviously, in Florida, they can be outside, which
Yes.
is a huge help.
Hmm.
Use common sense. I just wouldn't have a giant reunion. I wouldn't have my cousins from Wisconsin and the Dakotas come down, who are probably teeming with viruses. And so, someone called me the other day about one of their children had been exposed potentially, and should they were going to go up to the grandparents' home, and he had some medical problems, the grandfather, so they tested the child. Child was negative, and it really was not a great story for exposure. So I think very safe for them to go up, but again, they were going to wear masks. They were going to try to social distance as well as they could. So common sense and all the things we've learned to do over the last 6 months apply.
Yeah, without a doubt. And Melanie, you should talk to the weatherman at WFLA Channel 8 and make sure that he or she plans for very cool weather so that we can all eat outside on
Not too
Thanksgiving.
cool, just be perfect. Right.
There you go. Perfect. So we've heard that our positive rate in Florida is nearing 8% for the state. How do we lower that number?
Yeah.
Just
Well,
ask.
the usual answer. So I just the usual answer,
That's right.
but also testing more.
Mhm.
And I've even talked to the governor about this. There may be a point where you have to think about closing bars, and the areas that we think it's really hard to maintain social
Yeah.
distancing and face coverings with. I don't think we're there yet, but again, people really could control this. They just followed the rules,
Right.
we really can get through this if they
Mhm.
do that. So
And you do understand. I mean, it's not that I'm not sympathetic to the bar owners, and as I've said, and I know the state has CARES funding in Hillsborough County received as well, and I always felt that we should subsidize those bars so that they didn't have to open, because in many cases that can be a business that you've spent your life building up, and so my heart breaks for all of these businesses and individuals that are suffering as a result. And we've really just hit the tip of the iceberg. The economic impact is yet to come from this virus, and so we're working very hard on that aspect of it here in the city, in the county, the entire Tampa Bay area. So the last question is, how are the hospital numbers right now, and do they mirror the positivity
yeah,
rate?
so some of them are scary. Like there's been about 170% increase in admissions on a rolling average over the last 7 days. But in fact, that means we've gone from 8 admissions in Hillsborough County to 23. So, that's nothing compared to the summer. So it sounds really terrible, but, it is really not. I know that Baycare got hit a couple of days ago with a big surge. Tampa General has not seen that big surge at this point. We're watching it very carefully, but I think so far so good. I don't, and again, they don't seem nearly as sick, and obviously we're in much better position to make sure they don't get sick.
Excellent. All right, last one is, how are the Red Sox going to do next season?
So the
They're
questions
certainly
are
not going to win the World Series.
right,
The Rays
right.
are.
So you obviously have people from Dedham living, working in your environment that are focused on this, and I won't mention any names. But so the question is, are they going to bring back Alex Cora? Of course, I'm a Rays fan,
There you
but
go.
but I have some knowledge of the Red Sox, and I suspect there'll be a number of trades and
Yeah.
some interesting signings. We've got a great farm team, so fingers are crossed.
I tell you what, if that game 6 had been the final, was it game 6 that was Saturday night, the one that they won in the bottom of the ninth, 2 outs, 2 strikes? Oh my gosh, if that had been the final game for the World Series victory, people would have talked about that for the rest of all time. Hey, did you see that 2020 Rays game? Unbelievable. Well, once again, thank you so much, Dr. Lockwood. It is always a pleasure to talk to you, and I do appreciate you keeping us all informed and keeping our community healthy.
No problem. Thank you, and thank you for all you do.
No problem. It's fun. Every day is another adventure, that's for sure. All right, everybody, please remember to stay safe, stay calm, stay home, and remember that you have a lot of choices in life. So, in these particular times, take a deep breath, choose to be patient, and choose to be kind. Take care. God bless.